perspective on one of the aspects I believe is important for surgeons to understand in our changing healthcare environment. So I kind of want to talk about healthcare policy generally, but how surgeons, what our role is. And the case study that I like to use is readmissions, just because I happen to know a little bit about it. So disclosures, you probably will hear some things that are not politically correct. I apologize. I have no industry conflicts, but I'm actively soliciting them. And much of the data that was presented here is supported by NIH T32, as well as by UIC, but you can't really have a conflict if you're presenting at UIC. So why should surgeons care about policy making? I think primarily because of this guy. We all care about our patients. We want them to do the best. Part of it is by being good clinicians, but part of it involves understanding how the rest of healthcare works. In terms of what is healthcare and how is it delivered, it's at the bedside, but a lot of other aspects of society are involved in being able to deliver good, high-quality healthcare to patients at the bedside. So who does this involve? It generally involves physicians, nurses, other people we see around the hospital, as well as the patients themselves and their families and friends. But it also involves institutions who are acting as institutions, such as the hospital itself, insurance companies, device manufacturers, drug companies, and then governments at various different levels, the federal level, the state level, the local level, and then obviously all three branches. So in terms of what holds all these people together and what kind of binds them, it's policy. That's the way that we interact with each other without causing a lot of havoc. So why should we care about policymaking as surgeons? First, it enhances our autonomy as providers, as well as that for our patients. It can improve patient care and outcomes as well. It improves provider lifestyle for people who may not necessarily be interested in the top two things. And then it can present an intellectual challenge beyond just what we do as clinicians. So why do policymakers need surgeons? First, surgical patients are our responsibility. We're the subject matter experts in them, and having other people who are clinicians or tangentially related is really not the best thing to improve outcomes for these patients. If you look at what are the top 10 causes of death in the United States from like last year, heart disease, cancer, trauma, strokes, diabetes, the overwhelming majority of these at some level are diseases that we as surgeons treat. Some of them are diseases that we as surgeons, only we as surgeons can treat. In terms of why they also need us, well, one, we have a global understanding of how healthcare works. We are in the unique position as a specialty to have patients all over the place. I know as an intern, as a second year, this is like super annoying. You show up to work and other people, you know, they just have their floor of patients and they never leave it. We have to go see consults in the ER, go to the OR, day surgery, SICU, all over the place. But in terms of what does this provide us as a benefit, it really gives us a global understanding of how healthcare works to deliver patient care. And then finally, taking care of our patients is very dangerous as well as very expensive. So when people are making policy decisions that impact our ability to do our jobs, that's very problematic and can cause our institution and our country a lot of expense and a lot of danger. So I kind of wanted to divide policy making into 5 steps that are kind of related to patient care, or kind of analogous to patient care. So first you have to define the problem. You know, somebody comes in with a chief complaint or a consult question, if you're lucky to actually get a question, and then you get worked up, there's a critical appraisal of what's going on with this patient, you have to figure out the differential, and then you kind of execute on the plan, and you, at various stages, go back and see, did what I think was the hypothesis of what's going on with this patient actually match up. Policy making is pretty similar. At each level, there's an analogous point. So obviously defining the problem is the same. You have to evaluate the fundamental basis for which this policy has been built on. And then you consider alternatives to it, and then there's the implementation phase, and then once you've implemented, you need to figure out, well, did what we thought was going to work actually work? So let's look at readmissions as a case study. So first, what's the problem? People care about this because it's pretty common and very costly. So what was the solution that was found by the government? They decided to do CMS's Hospital Readmissions Reduction Program, which penalizes hospitals for, quote, excess readmissions. Well, well, what exactly is a readmission? What does it measure? Like, why does anybody care about this stuff? So, generally speaking, people think of readmissions as a quality measure. But I don't know that I would necessarily agree with that.